So continuing on our series of videos for our head-to-toe physical assessment, we are now moving into the abdominal assessment. Again, I'm going to start out with washing my hands. For the abdominal assessment, you want your patient to be flat. You also, to expose the abdominal area, you want to ask the patient, is it okay if I pull up your Johnny to really expose that area? Okay. Yeah. So I have my patient flat. I'm pulling up the Johnny to really expose that area that I'm able to see and do a good assessment of the abdominal area. So you're starting out first with inspection, again, as we always do. And what we're looking for, again, continue our skin assessment, looking for bumps, bruises, all those things, scars, scrapes, things like that that you might see on somebody's abdomen, any moles, any abnormal lesions. Again, take the opportunity to do a further assessment if there's something suspicious of a mole. Other things that you're inspecting for is the umbilicus midline. Note any piercings, which she has an umbilical piercing, which looks well healed. You can ask the patient, how long ago did you get your piercing? A couple years ago. Have you had any difficulty with it? No. And that way I'll give you an idea if there's any difficulty with that. Sometimes infections are common. You're looking for any striae, which are stretch marks. You're looking for any scarring. You're looking for any pulsations that you might see, or peristaltic waves of things moving through the bowels, which she does not have any. You're looking for the contour as well. Again, you want to get down, is her abdomen distended? Is it concave where it caves in? Things like that. Talked about pulsations because your aorta comes through here, so you're looking for those pulsations, anything like that that may be abnormal, and she has a normal abdomen. The abdominal assessment is the assessment where we get away from our normal inspection, palpation, percussion, auscultation. Instead of you doing palpation and percussion, we go to auscultation first. Reason being is that if we were palpating things to start with, it would possibly make an abnormal assessment when we start pushing things around in the intestine area. So we want to do an assessment of bowel sounds for our auscultation prior to any touching of the abdomen. So we move on to our auscultation. And what we do is we quadrant off the abdomen into 4 distinct quadrants. And we take basically each quadrant, listen in each quadrant for bowel sounds. You want to make sure that you hear them in all 4 quadrants. 2 spots per quadrant, using the umbilicus as the midline. So you can kind of visually see as I split the abdomen here. I would encourage you to start right lower quadrant and then move clockwise around, and that way you're doing the assessment the same every time. As you put your diaphragm or your stethoscope on to listen for bowel sounds or little tinkling sounds, again, depending on patient, there's between 5 and 30 per minute normal bowel sounds. If a patient's post-op and has slower movement within their bowel system, those bowel sounds may be much longer. You want to make sure that you would assess for a full 5 minutes before you determine that the patient did not have bowel sounds per quadrant. So I'm going to take a listen in the quadrants now with my stethoscope, listening for bowel sounds. When I hear them, I will continue to move on. Okay, and she has adequate bowel sounds in all 4 quadrants. While I have my stethoscope, I'm also going to assess aortic, iliac, and renal arteries as they come down through the abdomen. I'm going to listen for bruits. I, again, listen for bruits with the bell of my stethoscope. So as remember our anatomy, as it comes down, the aorta is coming off, it branches off to renal and then iliac arteries below the umbilicus. So again, listen in those areas for bruits with my bell. I would then also listen around the umbilicus with my diaphragm for any venous hums, which would indicate some liver engorgement, which is rare, but it's always good to do the assessment. So listening around the umbilicus for venous hums. Okay, and she does not have any. So again, all normal findings for the abdomen. We then move on to percussion after auscultation for the abdomen. What we're listening for is tympany in the abdominal area, because most of the time, it's an open area, so you're going to hear that hollow sound and noise when you percuss. Again, I like to use the reflex or percussion hammer. I find that it makes a louder noise, so for a better assessment. So again, starting in that right lower quadrant, working my way around. And as you can hear, tympany sound. If you get too high on the right upper quadrant where her liver lays, it may produce a dull sound, because sometimes if they have liver engorgement, the liver may be enlarged, and as you percuss, you may actually percuss over the borders of the liver, which would produce a dull sound, but that's on anybody with liver engorgement. So she has a nice tympany sound throughout her abdominal area, so that is normal. That's my percussion. And then I would do light palpation, again, starting in that right lower quadrant. What I would feel for is any enlarged organs, any masses, things like that. I would start out with light palpation, kind of gives the patient an idea of what it's going to feel like. If you have somebody that's really ticklish, you can actually have them put their hand with yours, kind of put your fingers through like this, and it kind of helps with that laughter if you need to. Otherwise, you're going to do a kind of a dip in motion as you do your light palpation. Again, you're going 1 to 2 centimeters for depth, feeling for any enlarged organs. And again, it's more of like a dip in motion that I'm using. Any tenderness with any of that? No. You then, once you've done the light palpation, you can, if you have a question of an enlarged organ, you can do deep palpation, which is really getting down and pushing in. It's uncomfortable, so I'm not going to do it here at Anna today, but that's when you could really, push down deeply to feel, to kind of pinpoint what organs are enlarged and where that discomfort is coming from.